I'm Dr. Mudit Khanna, Senior Consultant Joint Replacement Surgeon at the South Mumbai unit of Wockhardt Hospitals. I have special interest in the use of technology to perform online joint replacement surgeries. Today, we have a very exciting gentleman with us, Mr. James Jasper, a 71-year-old young gentleman who's traveled all the way from San Diego in the United States of America, traveled from what I know 28 hours to reach us in Mumbai, to have not one, not two, all three of the four major joints replaced. He had been suffering from osteoarthritis of his right hip and both his knees that was significantly interfering with his quality of life. So, without detailing much of this, let's go and listen from Mr. James Jasper himself about his courage, about how he could manage to take a decision to travel all alone, all by himself, come here to have all these three surgeries done, which have now been successfully completed. He's making a steady recovery, and let's hear from him himself to tell about what made him take this decision, how he feels about it, how he feels about the hospital, the surgeries, the surgeon, whether he was explained all of what to expect or not, and whether we as a unit were able to meet up to his expectations or not.
I've been suffering for about 10 years with my knees and my hip. And I've been wanting to have my hip and my knees done, but in the United States, it's so expensive. And I started researching it and looking, and I discovered India because of the specialists that are here in India. And I got on YouTube and found Dr. Khanna and Wockhardt, and they set everything up from the airport to my hotel to the hospital for all my surgeries. They've been by my side, taking care of me, and I've just had an excellent experience.
You're a very courageous man, let me tell you that. I think it's by far something that none of us can possibly dream. And you know, as we went through the procedure, after each surgery that we went, we had a discussion. We talked about how we are feeling, how we are recovering, whether we think that we are set up to have another surgery or not.
Right.
And we did the second surgery, the left knee replacement, pretty quickly because you had a great recovery at that time. And then obviously, these are big surgeries that take a toll on your body. And then you took a bit of time, but as I said, I would have probably thought, okay, that's where we should stop, and let you recover more from that procedure, and then maybe come back another trip.
No.
But you took your time, but then you were all set. I mean, there was no way I could not even see sort of a glimpse of doubt when I was speaking to you with regards to your commitment to have the surgery done.
But you explained everything to me too, in detail, what to expect, and that there could be problems with having both knees done at once. And we decided, because I had a problem with my hemoglobin with my blood, that it would be best to do one, and I had 100% trust in you, and it all worked out. So now I'm just recovering, and I'm back stable, walking, and I can't wait to go home. And that's everybody that said, you're crazy to go there by yourself, you're crazy to do everything at once, just do one. I said, no, I want to do it all at once, because I'm going to go through so much pain that I want to do all the pain at once and get it over with, and I'm glad I did.
I must also admit that we were taking all kinds of precautions to make sure that we're absolutely fine and ready and prepared. There was an entire team of physicians that was looking after you. We had the anesthetist dropping by and making sure that you fit for the procedure. But as I said, even we find that all parameters are good for you to go. At the end of the day, you've gone through recovery from one hip, you've gone through the recovery for the knees. I did tell you that recovering from a knee takes a bit longer than recovering from a hip. And then even though all parameters were stable, it still needs courage and determination to go and have the second knee done, the third operation in the row. So very well done, and we're all very proud of the way you've for the way you've carried yourself with the physical therapy after the procedure, because we say the surgeon's job is only half done.
Right.
Half of it depends on the patient himself, on how well they keep themselves motivated. We could see you walking, taking a stroll, and towards the nursing counter, in the corridors, every time, every now and then, so that you could speeden up your recovery. So extremely well done. But with James, it doesn't end here. He's got another 10-14 days before he leaves, and whether you would believe it or not, he's waiting to have both his carpal tunnels done a few days before he leaves. So we've got one amazing person here, and he deserves all the applause. Thank you very much, James, for